Don't assume that that's going to be a swimmingly smooth process. I feel like a lot of times the intensive care unit providers, hospital providers like myself, sort of make assumptions that we know sort of what's best about administering meds and equipment and other things. But we often overlook things. And again, when you have a child coming in on 15, 20 medications and lots of respiratory equipment, and you're so focused post-operatively on blood pressure and just breathing, and you're making sure the kid's going to stabilize out, some of this other stuff gets lost in the periphery, but never gets reinstituted in a timely manner or in a high-quality manner in the hospital, and that can lead to long-term problems for recovery. So encouraging families to be vocal about, hey, at home we're using this cough assist, or we're using this way, and I'm assuming this has been happening here, but has it? And having the explicit conversations with the inpatient providers to make sure everything is in place.
I think something I would want to share with families going through the experience is just reminding them how valuable their perspective and their knowledge of their child is in the recovery time. Often the patients are most likely going to the ICU. I think that's pretty much a given in most cases. If not, they're going to a floor that can manage them. But being present and being there to be able to help as much as possible, share, who they are, how they communicate, help be the communicator translator for them if they're not well enough to communicate in the way they typically would. For many of us that care for complex patients at home, we really are the best people to do that. So that's often hard in an ICU environment. It takes a lot of patience on the family's part, also with the provider, the provider's part to understand that it's a kind of a unique situation for someone coming in that's lived a very complex life on the outside, that they bring so much knowledge with them, and it's important to listen to what the parents have to say. I often say, you can be in the best hospital in the world and you still really need to be vigilant. And I wish that wasn't the case, but just with the pace of the medical world right now and how things are staffed, oftentimes it's really important to be present and to be able to offer help and suggestions to make your child's experience the best experience possible.
I'd like to reinforce what Erin says and just point out that particularly in the postoperative period, the phrase that the doctor knows best really isn't true. The parent knows best, and that we really rely on, and sophisticated nursing staff really relies on the parent's perception of where their child is relative to their normal health status. Sometimes parents are afraid to speak up. They feel like they're not in a position of power. They're not empowered to speak up. But we really rely on their continued vigilance, both on their child's condition, but also just odd things like medications. Like, I remember 3 years ago, my child got that medication, and it didn't really work very well. He had the following problems with it, and it seemed to interfere with the seizure medications. Have you thought of that? And the sophisticated caregiver in the hospital will say, "Oh, well, thank you very much. Let me discuss that." The less sophisticated person will say, "It's the orders. Quiet parent. We're going to give this no matter what." So, I think in most sophisticated care settings, we really value the parent's input. And how the patient does depends upon partly how vigilant the parent is. If the parent just disappears and says, "Well, it's a hospital problem, I'll come back in a week and pick them up," that doesn't work well.
And I think that vigilance and input is so unbelievably important at episodes of care transition. So, you think about it, it's transitioning from anesthesia into the operating room and then out to the ICU, then very likely, again, out from there to another care team on an inpatient floor that's going to be taking care of you, and then being discharged home. You may, quite frankly, experience 15 different providers in charge of your care during that time. You may have medical trainees and residents who are there who may never have encountered a clinical condition like the underlying neuromuscular condition that your child has. And again, so many things are risky, I think, in these handoffs of important information to convey, again, how to administer the medications and the equipment and all that. And I think that's when we see things that, quite frankly, just don't go as well as they should. And medications are dropped, or doses are changed, or equipment is not thought of. And the post-op recovery for these children is so incredibly important. You want to stabilize them as much as they can with all their underlying support. And if that support is not optimal with what you're bringing into the hospital because of the way that we ordered or administered it, then it can prolong the children's recovery. So I think this is an incredible opportunity for parents to, if they see something, say something, speak up, and not be afraid to say, this is what we're doing at home, it's not happening here, can you tell me why? Or was this an explicit decision about why these meds aren't being put on, or the equipment's being used in this way? And to not feel like they're that bothersome parent, the helicopter parent inside the hospital that's just, nitpicking at what the inpatient team is trying to do, but really perceived as a true contributor of the information and the way that care is being managed to make it best for their child.
And one way we did that we found was really helpful was we would, at the start of every shift, we would touch base with the nurse and kind of review, like, okay, what meds were actually given, was anything changed in the last shift due to whatever, whether it be something with Will or something was happening on the unit, and then try to get back to his daily routine as much as possible. And the nurses were helpful in doing that when we would just take almost like a huddle, like, the nurses have their changeover of shift and they hear from the other nurse what happened. We always wanted to touch base and say, okay, what have you heard? Where are we at? And what can we do to get him closer to his normal routine?